Hello and welcome to class. Our topic today is infant care. We will be practicing with our real care babies, and we'll be discussing techniques that are applicable to them as well as live human infants. For this first part of class, I will be doing some demonstrations, so I ask that you please listen and follow along, and then later on you will all have the opportunity to try it for yourselves. I know you're all very excited as this is the first time we've brought the babies out, but hold tight, we will all get a turn to practice. Okay, so with your real care infant babies, there are 4 care requirements that it has: feeding, burping, a diaper change, and rocking. Okay, some of these techniques are going to be applicable to both the infants, the robot babies, and live human infants, and we're going to talk about all of them. Okay, so we'll start with feeding. This baby is turned off right now, it's not going to cry. Whenever you're feeding an infant, whether it's this real care robot baby or a live human infant, we want to make sure that they're at somewhat of an upward angle when they're being fed. If they're laying flat, it's going to be harder for them to digest. So, they don't have to be sitting completely upright, but you can see that they're at an upward angle. Okay, with the real care babies, you need this specific bottle because there's a sensor in the tip that connects to the sensor in their lips. So your real care baby is going to cry, and it's your job to figure out what it needs. If it needs to be fed, you'll know you guessed correctly when you touch the baby's lips with the bottle and you start to hear a sucking sound. That means yes, the baby was hungry, and yes, you guessed correctly. Okay? You're going to continue to hold the bottle to its lips until it stops sucking and makes a happy cooing sound. Then you can take the bottle away and wait for the next act of care. Okay? Typically, for a live human infant, after feeding the baby, you would always want to burp it, after the feeding or in the middle of a feeding. With the real care babies, I did not program them, so their programming does not always have burping follow feeding. But for a live infant, we'd always want to burp after feeding or halfway through feeding. Okay? The purpose of burping is to expel excess air. When babies are sucking on a bottle or nipple, they're swallowing excess air, which causes them to have upset tummies. So we burp them to help expel that excess air so they can feel more comfortable. When we burp a baby, there's 3 ways you can do it. Everybody is going to have their own preference, and babies themselves could have a preference as well. Any of these 3 techniques I'm about to show you could be used with this real care baby. Okay, the first, and what you'll probably see most often, is burping over your shoulder. So you'd want to have a burp cloth, placing the baby over your shoulder, and we want to make sure their airways are clear, that their nose and mouth is not stuck in your clothing, which could cause them to suffocate. I'm going to support the baby's head. An infant's neck is very weak because the muscles are weak and the head is very heavy. So we want to support their head. Then we're just going to pat them on the back. It's going to be loud because this is hard plastic, but we do want to hear it. If it's silent like this, whether it's on a real care baby or a live infant, you're not doing it hard enough to push the air up and out of their bodies. So listen. That's not going to hurt this real care baby. It's also not going to hurt a live infant. Okay? So you may try that. Another technique is to hold the baby on your lap and supporting their chin and cheeks with your hand. So it's like a C hand shape. Under their chin, we're not blocking their airways. Okay, you're gonna hold the baby here. They're being supported by your hand. And you can burp them this way. I find that this is more comfortable for me, but you can see what's more comfortable for you. Again, when you hear that sound, you're not hurting them. It's not going to hurt this baby or a live infant. It's just especially loud because this is hard plastic. Okay, a third technique, we're still going to be supporting the baby's head with our C-shaped hand. Here he is. And we're laying the baby across our lap. Okay, so same thing, patting them hard enough that we can hear it. Those are 3 different techniques. You can try all 3 of them. With a live infant, you may find that they only like it when they're sitting like this so they could see you. Maybe they get distressed when they're here or here because they can't see the caregiver. Okay, so you'll have a chance to practice that in a moment. All right, so we just talked about feeding and burping. Let's move on to diapering. Okay, first we'll talk about our real care baby. It does not defecate or urinate. You're not going to have to deal with any messes, but it does need a diaper change. Currently, it is wearing the yellow diaper, so I have the green one here. To do a proper diaper change, you're simply going to swap the yellow and the green. There are different sensors associated with the colors, so its computer system is going to recognize a diaper change. Okay? One of the easiest ways to do this, you have to bend their legs a little bit. Again, they're not alive, so you have to manipulate them a little bit. Simply unfasten the Velcro, lay it down, you can grasp their feet with your hands, slide out the dirty diaper, slip in the clean diaper, and fasten it. When these babies are turned on, if it needed a diaper change, as soon as the sensor connects to their back, you'll hear a happy coo sound. And that signals that yes, it needed a diaper change, yes, you did it correctly. Okay? If we were to be doing a diaper change with a live infant, it's going to be messier, right? There's fecal matter involved, there's urine involved. Okay? So the first thing we want to do is make sure we have all of our supplies together. We wouldn't want to get the baby all set up and then forget about our wipes that are across the room. Okay, so make sure everything is together where you're going to be changing this diaper, whether it's on a mat on the floor or a higher changing table. Okay, now we have all of our supplies. Next, it's time to wash our hands. We don't want to be introducing any germs into the baby's genital area that could cause infection or bacteria buildup, so we're going to wash our hands. Our hands are clean, we have our supplies. We're going to put baby in the changing position, whether it's on the mat or the changing table, either or, wherever you may be. Okay, if you're on a higher surface like a changing table, you want to make sure that the baby is secured in some way. It should come with straps that go across the chest or a little harness type thing, and that's going to keep the baby secure. It would be very unfortunate if they were to fall off and get hurt. Now the baby's secure, we can start undressing them, making sure the clothing is out of the way so it doesn't get messier than it needs to. And then, similar situation, unfasten the diaper. You can use the diaper to wipe for the first time to get rid of any fecal matter or urine involved. But after that diaper comes unfastened, if you're dealing with a baby boy, you want to cover their genitals because the temperature change after being undressed could cause them to spray and make a mess. So if you just cover them with a clean cloth, that could prevent the spray. Okay, so we've wiped them with the diaper. Now we want to go in with some wipes and get all their different skin folds. Babies are a little chunky, they have skin folds in different places, and we want to wipe all of those so germs aren't lying away hidden. That could cause bacteria buildup and lead to an infection or an uncomfortable rash. Okay, so once you've got everything wiped down, you may notice some red spots where they might need some diaper cream. That's a good time to apply it now. Then, again, just like the real care babies, lifting their feet up, sliding under the new diaper, and fastening it. Once you have it fastened, you can do the 2-finger test. If you put 2 fingers between the diaper and their skin, it should be comfortable. Not too tight, not too loose, 2 fingers between the waistband and the skin. Okay, and there you have a diaper change. After that, we should redress the baby and put them in a safe location, down off of the table. We can wash our hands, gather our dirty supplies, throw them away, clean the changing area, whether it was on a mat or the changing table, and make sure it's ready for the next use, whether it's at your own house or maybe you're in a public place. We want to leave it nice for the next person. Okay, last thing we need to discuss is rocking. We're going to utilize the 5 S's for soothing babies when we have an upset baby. Okay, so the 5 S's are supposed to replicate the sense of security that the baby felt in the womb. The first is shushing. Shushing is going to replicate the sound of blood flow that the baby heard while it was in the mother's womb. Similar to if you hold a seashell up to your ear and you hear the ocean, that's the blood flow. The shushing sound, shh, that we'd say to a baby is replicating that sound, and it helps calm them down. Second is swaddling. So wrapping them in a tight blanket is going to replicate the sense of tightness that they felt in the womb. There wasn't a lot of room to move around in there, so that tightness is going to help them feel secure. Okay? Sucking, if we offer a pacifier or a bottle, sucking is going to lower their blood pressure and lower their heart rate, which ultimately calms them down. The next is having them on a side position. So the baby was very close when they were in the womb. So if we're holding them out here away from us, they don't feel much sense of security. If we hold them tight to our side, making sure that we're not blocking their airways, they're going to feel more secure. Okay? Lastly is swinging motion. When the baby was in the womb, the mother wasn't always walking gently and smoothly. She was just walking and the baby was bouncing along wherever she went. So a baby that is already calm will remain calm with a nice, gentle swinging motion. But a baby who is elevated and distressed in some way needs to have a bit more of a bounce to them. Okay? So I'm going to take our friend here. So this nice rocking motion, he's calm right now. This is okay. But if he were to be crying and in distress, we would want to have a bit more of a bounce. And this, studies show, helps calm the baby down quicker. Okay, you may sit, maybe you're standing and bouncing with them, but that's a proven technique to calm them down. So when you take your Real Care baby home or while we practice, I recommend that you do a bouncing motion when they're distressed and you need to rock them. Okay? So now we've learned about feeding, burping, a diaper change, and rocking. I'm going to turn this little guy on now, and we're going to see how it works in real time. Okay? That chime means he's on, and he's starting to fuss a little bit. When he needs care, I have to swipe my ID badge before he will recognize that any care is happening. There's a chime. Okay, I've got him in a slightly upright position, and I can hear the sucking sound. That means I've guessed correctly. He did need to be fed. While we're practicing with these babies, it's going to be a shortened amount of care. It's in a demonstration mode, which means everything is smushed together. When you actually take the baby home, it will take longer to feed, longer to burp, longer to rock. He's still eating. In a few moments, we should hear a happy cue sound. There it is. Okay, so again, with a live infant, excuse me, the next logical thing to do would be to burp them. The Real Care babies, that isn't always the case, but I've programmed this demonstration so it does go feeding and then burping. So when he starts to fuss again, make sure to swipe the ID badge so it recognizes it's being cared for, and then I'll choose my preferred method of burping. There's the chime. I'm going to support his chin in the C position and pat him on the back loud enough that I can hear it. You can hear him breathing a little bit heavy. That's what it should sound like. Again, it's not going to happen immediately. Be patient. So it's very quiet, but he did do a little burp. It's one of the harder ones to hear. Okay, now we're just gonna hang out and wait. So as you take them home, again, it's going to take a bit of time. There's the chime. Next up is a diaper change. Unfasten the dirty diaper, lift up his feet. And as soon as that sensor connects, he's going to make a happy cooing sound. And that signals that you did it correctly. As we're practicing with these babies, make sure you're always supporting their necks. This is a simulation, so we're using this baby as to represent a live infant. So we want to treat them as we would a real live human infant. Their heads are heavy, their necks are weak, so we always need to support them. Starting to fuss again, I'll swipe my ID, and now I choose my preferred method of rocking. Okay, I'm going to choose the side position and give him a little bounce. I'm supporting the head. You can sit, you can stand, you could be in a rocking chair, whatever works for you. You're going to hear him continue to fuss a little bit, but when he's happy and content, he's been rocked enough, you will hear the happy coo sound again. Again, this is going to last about a minute with this simulation in class, but when you take it home, there's his happy sound. When you take it home, it could last 15 to 20 minutes, and there's also times where you may just be fussy, and you need to rock and up to 30 minutes until he's calm. And remember, this is supposed to be a simulation for a real live caregiving experience. So we want it to be like how it would be taking care of a real infant, and these do a very nice job of doing so, right? So that's all for the demonstration. Next up, you're all going to get a baby passed out to you, and we're going to try feeding, burping, rocking, and a diaper change. Thank you.